A placebo is a substance or therapy which actually has no therapeutic value. Typically, placebos are inert tablets such as sugar pills, although they can also include saline injections, faked surgeries, and a range of other medical procedures. It is believed that placebos can influence the way in which patients perceive their condition, encourage chemical processes within the body that relieve pain, and potentially alleviate the effects of other symptoms as well. The placebo effect refers to the phenomenon where a patient experiences a positive therapeutic outcome with an inert treatment. So, does the placebo effect actually exist? By the way, if you're passionate about learning and discovering, then please like, share, and subscribe to this channel. We've always known that the mind is an incredibly powerful tool, and the idea that we can heal ourselves without any treatment and through pure will alone has been around for thousands of years in ancient medical practices. Generally, placebos are traditionally used in clinical trials to test how effective new medical treatments and therapies are. It's used most commonly for drugs, where a placebo drug will be given to a sample of people in a control group, whilst another group of people are given the actual drug that is being tested. The researchers will then measure the two groups of patients and assess their reactions. If each group demonstrates the same reactions, whether there's a positive or negative change or nothing at all, then the actual drug is deemed to not have worked. If a noticeable change occurs in the group that has been given the placebo, then this is attributed to the placebo effect. This reaction doesn't necessarily mean that the actual drug hasn't worked, but rather that other mechanisms are at work in the placebo group. The placebo effect is so much more than positive or hopeful thinking and just believing that a particular procedure will work, however. It essentially carries a stronger and more intuitive connection between the brain and the body and brings them into closer synchronization with one another. Of course, a placebo wouldn't be able to shrink a cancerous tumor or cure a genetic disease, but it can improve symptoms by changing the brain's perception about things such as pain, for example. The placebo effect has been shown to work best for conditions such as stress-related insomnia, pain management, chronic fatigue, and nausea. Whilst we know that placebos do work, we still don't understand why they work. The placebo effect involves a complicated interaction between the brain and our body, where the brain encourages the release of endorphins and dopamine and increased activity in the regions of the brain that control emotional reactions and self-awareness. These interactions have a therapeutic effect because they promote feelings of well-being and a positive mood. However, the ritual of treatment is an important part of the placebo effect as well. Simply believing that you'll recover and then not taking any steps beyond that wouldn't be enough. In studies where the placebo effect has been shown to work, the patients have been in a whole environment and taken actions that are related to healing. In most of these studies, they have appointments at medical facilities that they have to attend at certain times, where they are consulted by health professionals with stethoscopes and white coats. These patients also receive pills or injections and are given specific instructions and medical advice that they have to follow. Each of these factors cement the idea in the patient's mind that they are being given a treatment in a facility which is legitimate and has been extensively researched, and this gives them the confidence to place their complete trust and belief behind the therapy that they're being offered. Knowing that they're being cared for and given attention can go a long way in encouraging recovering and healing, and can have a profound effect on the patient's experience of particular symptoms. Research is constantly revealing more and more things we didn't know about the placebo effect. Before, it was assumed that disguising placebos as actual treatments and deceiving patients was necessary for it to work. But it's since been found that placebos can have a positive therapeutic effect, even when the patient knows that it is a placebo. Scientific studies have demonstrated that the placebo effect doesn't only work, but it can be as effective as traditional treatments, under the right circumstances, of course. It is important to remember that it is still somewhat controversial, especially when it's used in a clinical context. The placebo effect certainly wouldn't be the right choice for every condition, but when it is applied carefully and empathetically, then there is the potential it could make a meaningful and worthwhile contribution to people's lives. If you enjoyed this exploration, then don't forget to like, share, and subscribe to this channel for even more fascinating insights.